Hi, my name's Amanda and I'm the lead nurse for Integrated Sexual Health Services. We call it the MISH Centre for short here. We're located in Kensington Road. We moved here in the autumn of last year, so we've moved into a nice new building with more clinic rooms, which are nice and bright and modern for us to be able to see more patients. There's quite a demand for our service, so we're hoping that our new premises will help us to help you to get appointments when you need them most. We're here today to talk you through a tour through the service, what it's like when you come to the clinic, to reassure you that it's not a frightening place to come and that when you come here, the staff will be really friendly and welcoming. We're not here to judge you or to tell your parents or anything like that. We're here to help you and support you.
The entrance to the Manx Integrated Sexual Health Centre is on Kensington Road. You can catch a bus to Westmoreland Road and get off at Henry Bloom Noble School. Walk past the Manx Care Community Health Centre and up Kensington Road. Past the tennis courts, and the MISH Centre is on the right. Alternatively, you can reach the MISH Centre by catching the bus to Bucks Road and getting off by the Terrace Shops, and turn onto Kensington Road near the Trinity Methodist Church. Stay on Kensington Road, walk past the phone box, and the MISH Centre will be on your left.
So we understand that young people especially will be nervous coming to a clinic like this. Often it's a young person's first experience of entering a healthcare setting without an adult. Usually it's their first appointment without somebody else with them. So we understand that. The staff here are very, very welcoming and very reassuring. Don't ever be scared to come and see us. The other thing to tell young people is that we know that most people under the age of 16 are not having sex, but some are having sex and some are contemplating having sex. So we are here to help you look after your sexual health needs. Think about contraception, think about infections. Don't be worried about coming if you're under 16 because we won't be telling anybody else that you've come to clinic. It's a confidential service. There are exceptions to those rules, but they would be explained to you when you come to clinic.
Please don't ever feel nervous or frightened about coming to see us. We're all really friendly, we're all approachable. We just want you to come and see us and look after your health. So come and see us, bring a friend. We'll do whatever makes you feel comfortable. Everything here is voluntary. We don't force anything on you. So just make an appointment and we'll do anything we can to reassure you.
Hello.
Hi, welcome to the MISH Centre.
Do I need an appointment to come in?
Yes. If you do attend without an appointment, we will always get someone to speak with you, but we can't say how long you may have to wait.
We welcome individuals of all ages, all sexualities, any gender identities. We would encourage you to come and talk to us. We like to think that this is a safe environment where you can come and get the support that you need.
Please can you fill in this registration form? It's really important that we have a way to contact you with any test results. Usually we do this by mobile phone. You'll see it asks for a password. This is for extra security. We also send text reminders for any future appointments you have with us.
We would just like young people to remember that we're not here to judge you, we're here to help you and support you and guide you. You can always come here for advice, and sometimes we give a lot of people just some advice and support. We have to remember that today's world that we live in, lots of young people are accessing information online, and we would encourage you to access something that is reliable and the information is good information. There's lots of misinformation out there. If you look at our website, there's lots of links on there where you can get good information, and always talk to an expert. They're not always experts on social media platforms and they might not be professionally qualified. So really do get help and the expert advice from the right people.
How long does the appointment take?
It can vary depending on the individual. The doctor or nurse will spend as much time as you need with them.
Some particular misinformation that we're quite concerned about that we hear regularly is young girls and women saying that all hormones are bad for you and seeking natural contraception. And we would just like to address that. Please, if you need contraception, consider coming to talk to one of our expert health advisors who can talk to you about all the different methods. Really do get the right information before you make a decision not to use contraception, because often it ends up in unplanned pregnancy, which nobody would really want. The other side of social media platforms is body image and the expectations of what you're supposed to look like. We hear a lot of young people come in and just say, am I normal? Is my anatomy normal? Does this look normal to you? And we just say to everybody, you are an individual and what you look like is what you're supposed to look like. That is your body and no two bodies are the same. It will be normal. But we will examine, if somebody wants us to examine them, we will examine them to give them the reassurance. But it's just a flavour of some of the things that young people come in and they find it very confusing, quite bewildering because there's so much information out there. Please come to the right place. We're here to help you.
Take a seat over in the waiting room and we'll be with you shortly.
Hi Sam, do you want to come through now? One of our clinicians will see you. Follow me. Don't look so nervous, you'll be fine. Come on through.
Well, first of all, we'll talk to you a little bit about why you're here, what brings you in to see us. We will want to know a little bit about your general health and well-being for our records. If you are under 18, we might want to talk to you a little bit more about your life in general, your home, school, social life, things like that, just so that we can assess that you're safe and that we don't think you're at risk of any harm at all. Also, if you've been sexually active, we will want to talk a bit more about that. We might ask you some questions so that we can determine that we're doing the tests for you at the right time and the right tests. And also, we might want to talk to you about contraception, so that's preventing unplanned pregnancy, and how to protect yourself in future from acquiring infections.
If I'm under 16, do you have to tell my parents?
No, we don't have to tell your parents. We do encourage you to try and confide in a parent or a responsible adult if you can, but we do understand that for all sorts of reasons that's not possible for everyone, in which case we're here to support you.
What about my family doctor? Will they know I've been here?
No, your GP won't have any access to your records here in our department. In fact, the only time we have to talk to any other professional about you is if we have any concerns about your safety, if we think you might be at risk of any harm. We're actually not allowed to discuss our patients outside of our department without very good reason. And if we were going to talk to anyone about you, we wouldn't do it without talking to you first.
Do I have to get undressed or be examined?
No, if you have any visible signs or symptoms that are troubling you, then of course we will offer to examine you, but you can always say no. If you have a routine checkup, usually that can be done using a simple swab or urine sample.
But what if I feel fine? I'd know if I have an STI, couldn't I?
So no, not necessarily. The majority of people with chlamydia, for example, don't have any symptoms, so they wouldn't have a clue that they've got an infection. The important thing is if you have been sexually active, we recommend that you just come and get a routine checkup. After every sexual partner, anytime you have a change of partner, come and have a checkup with us.
How will I find out my results?
Results usually take about a week to come back, and generally what we do is we would send you a text message. The message doesn't say who it's from, so it's an anonymous text, just telling you your results are all clear. If they're not, of course we would try to get hold of you on your mobile. That's usually our first choice, but if you don't want us to contact you that way, then we can make a plan that suits you better.
What happens if I have an infection?
Okay, so if you do need any treatment, we invite you back to the clinic for that, and we give you the treatment here. You don't need to pay for it, it's free. You don't need to go to a chemist for that. We would also talk to you about how you might want to inform any recent partners because they'd need to be tested too. If for some reason you can't talk to them and can't tell them, we can do that for you, and we can do it without mentioning you if you want us to.
What's the best contraceptive for young people?
Oh, we get asked that question quite a lot, so it depends entirely on the individual. There's lots of different methods of contraception out there, and yeah, it's an individual choice, so we work with you until we find the best contraception for you. Some young people are happy to take a pill every day, some young people want to take a patch that they change once a week, but we know that young people have got really hectic lives, you know, you're really busy, so sometimes what we call long-acting reversible contraception can be good. Something like an implant, just a little rod that sits underneath your skin there, lasts for 3 years, really effective method of contraception. So come and see us, you know, we can talk to you about lots of different methods of contraception.
So what types of contraceptives can I get here?
So the types of contraception that you can get here, you can get pretty much any type of contraception. So you can get pills, patches, long-acting contraception, we provide condoms, so any sort of contraception that's available on the market is available here. It's all free of charge, you don't need to go through your doctor, just make an appointment and come and see us.
What about the morning after pill?
In terms of the morning after pill or emergency contraception, as you might hear it called, yeah, we can provide lots of different types of emergency contraception here. So there's a few different types. There's some that you can take up to 3 days. There's also one that you can take up to 5 days, and we can also fit an emergency coil as well for contraception if need be. Again, just drop in and see us if you're passing and you know you're really desperate for emergency contraception, or make an appointment and come and see us. It's also available through the chemist or through your GP as well.
I'm worried I won't remember all the information you've given me.
Don't worry about remembering the information that we tell you. Sometimes it might feel that we bombard you with lots and lots of information, but we can send you a link with your permission to your phone that's got lots of information about various types of contraception, about our service. So yeah, really don't worry about remembering everything that you tell us.